So my name is Dr. Daniel Leonard. I'm a board-certified pediatrician in Hastings, Nebraska, working at the Children Adolescent Clinic and Mary Lanning Healthcare. So last week, third week of June, we had a great milestone come to us through the course of this pandemic. Long-awaited vaccination for infants ages 6 months and over was approved for the FDA EUA, or Emergency Use Authorization. This has been several years in the making since the inception of the pandemic, when we were identifying high-risk groups being the very old, the immunocompromised, and the very young. Naturally, through the course of research, vaccination in particular, pregnant women and children tend to be the last group of people who are authorized or approved to use a product, the vaccine for COVID-19 in this case. We have to capitalize and maximize the safety of a product, of a vaccine, of a medication. Regardless of the benefit, the safety must outweigh that, and we've done a phenomenal job. All the medical scientists, all the researchers working on this, the health departments, so many players in getting this to the public to be available and safe. And I can't underscore how safe this product is and how efficacious it can be and needs to be in order to get us through to better times and make the pandemic part of history books. I have also been working as a medical scientist performing clinical research for both the Pfizer and the Moderna COVID vaccines for children ages 17 and younger. I've had every cohort, every age group, and we have had people from all over the country, literally all over the country, drive to Hastings, Nebraska here to be part of that trial. There are about a dozen physicians for Meridian Clinical Research who I work with, who all combined our data, pooled our data, had routine audits from vaccine sponsors, FDA, making sure that all lines were crossed, all I's were dotted, and again, the priority being the safety of what we were doing. Were the subjects in the study responding appropriately to the vaccine, and were they doing so in a safe way that really had very few side effects? And the overwhelming answer, fortunately, obviously, has been yes. That shouldn't be a surprise in pediatric medicine. We all know that childhood vaccines are very common before your 5th birthday. We take advantage of a child's innate immune system to maximize our vaccine benefits. And if you have a young child, you probably remember in their first year of life, they've had several vaccine series. So the need for multiple doses of one vaccine is not new to healthcare. It's pretty standard practice for most of these diseases we're trying to prevent. Obviously, both the Pfizer and the Moderna products fall in line with that. The Moderna series being a 2-shot series, about 4 weeks apart, and the Pfizer series being a 3-shot series. It's important to remember both products are incredibly safe and very effective, particularly at preventing hospitalization, severe disease, and death.